because this is almost gone. Wait for Leslie, but I usually don't wait. Why are you always rushing?
Because I wasn't expecting to be late today. But
What happened?
They closed down Eastern by my house.
Oh, the construction.
Yeah.
That was a long construction when we went there.
Oh, yeah.
Right in front of the pharmacy you're going to.
And they closed it all down.
Oh, yeah. Are you driving or are you getting dropped off?
Driving?
Oh, you should leave earlier then. You controlled
Yeah,
it.
I forgot about that. But they actually like closed down Eastern and Charleston, so you can't.
Oh, those are two big cross streets too.
Yeah.
So it's long.
Yeah.
And then adjust tomorrow.
Yes.
Presentation.
Yeah, even when I was driving here, the entire Eastern was on construction.
Yeah.
Whole Las Vegas.
Miss, I know it's always, that's why our GPS is never accurate.
Yeah.
Miss Laura and she had a hard time getting out from the pharmacy because the holes are there right in front of the pharmacy. I remember my friend opened a pharmacy and then construction happened. He shut down the pharmacy because he doesn't rely on deliveries and like online at that time, a long time ago. It's just walk-in patients, you know, so he had to shut down his pharmacy because of the construction that went on. Anyway, this is Leslie's topic. I don't want to go like covering it a lot for her because it's such a good topic. But let me show you something. Okay, I think we're ready. Let me see something short.
Isn't it like that here?
It was here, and then that does not make sense.
It's like an air balloon.
I think it is.
Okay, this one is really short. Let me share my screen. Share screen. Screen 2. Oh, starting. Don't start, please. Okay. Good morning, pharmacy. Okay, let's start even if Leslie's not here. This is Leslie's topic. I gave her an easy one because she doesn't have a partner, she's by herself, but it's really interesting, okay? Before we do that, let's review again. The laws, starting off with 1906. Remember, that's the first ever? We'll go like this. Okay, first law, Geneva, 1906.
It's the Federal Food and Drug Act. It's pretty much to say FDA is required, no, not FDA. Back then, it's required for all the labels to be truthful.
Very good. The word truthful. Labels must be truthful. Okay. Next one.
So 1914 Harrison Act.
1914 is next. Okay. Harrison.
Narcotic Act.
Narcotic Act. Okay. Continue. What's about?
Limitation of opium.
Limitation of opium. Why?
Because a lot of people were abusing it.
Mm-hmm. Next. Clyde. What's the next one?
Federal Food and Drug Cosmetic Act,
What year?
1937.
Actually, it's 1938.
I think manufacturers must prove to the FDA that the product is safe.
Not only truthful, but also safe. Okay? There was a big event that happened in 1937. That's why he mentioned 1937, because that brought about the changes in the original 1906 Federal Food Drug Act. What happened, Clyde, in 1937?
What I mentioned about 1938, I guess I got them confused.
Okay, so can you continue, Vanessa? What happened in 1937 that brought about the updating, okay, or amending of the 1906?
Death of like 100 people from a drug that contained diethylene glycol.
Diethylene glycol, yeah. Contamination, which is what?
It's
It's
for an antifreeze.
an antifreeze, correct. Okay, what are the other things that happened in 1938 amendment? What was added?
The warning of alcohol.
Yeah, the warning for addictive drugs or easily abused substances. They must carry on their label, auxiliary label, warning, maybe habit forming. What was added on the title of the law as well? The word cosmetic. What was created? What organization was created during that time? FDA was created. Okay, good job. Are we forgetting something in 1938? What else? NDA. Okay? A new drug application must be submitted if a manufacturer is what? Trying to test new substances, new drugs, or new compounds for what? For humans. It must be what? An application, which is called the NDA, new drug application, must be submitted first before testing it on humans. Okay? Because not only should it be truthful now, it should be safe. Okay? Continue, Caitlin. After 1938, what's next?
1951,
Mm-hmm.
the Durham Humphrey Amendment.
Very good. What happened here?
They required to add the labeling caution.
What's the caution?
Federal law prohibits dispensing without a prescription.
Why did they add that on the label? So that, what does it differentiate?
The over-the-counter drugs and prescription drugs.
Very good. Not everything you can get now by just going to a pharmacy. They have to identify which is over the counter and which one is prescription, right? Okay, very good. What's next? After that, big event. Ashley.
In 1962, the Harris Amendments.
Kefauver-Harris Amendments. Okay. What happened here?
So it extends not only be safe but also effective.
Okay, now truthful, safe, and effective. 3 words now, okay? What happened that brought about this amendment? What happened in 1962?
The thalidomide event.
Thalidomide.
Thalidomide.
Say thalidomide. Don't be in a rush. You know why you're having a hard time? Because you're always in a hurry to read it. Don't be in a hurry. Slow down. Thalidomide. You see that?
Thalidomide.
Okay. Look at the paper, what you're reading, okay? Because the answer is not on my face. You guys always look at me when I ask you like specific things, like the answer is on my face. Okay? For things like this, look at the paper so you don't get overwhelmed. Okay? The words are not gonna bite you. Okay, let's go. Thalidomide event. What is that thalidomide and what happened?
Severe birth defects happened in Europe.
severe birth defects happen in Europe because of what?
But it is like marketed towards pregnant women as a sleeping pill.
What is marketed towards? What is marketed as a sleeping pill or a morning sickness pill? Actually,
The drug thalidomide.
the drug thalidomide. Okay, were the Americans affected greatly during this time?
No,
No. Why? Why not?
because it's not approved in America yet.
It's not approved for market in the U.S. yet at that time. Here comes my era, 1970s. 1970, back to you. Just smiling. I'm your mom's age, about, right? Okay, 1970. You know, some of my friends got grandkids already. The ones that started early. Yeah. So, anyway. Comprehensive, 1970, continue.
So the Comprehensive Drug Abuse Prevention and Control Act
Okay.
was enacted.
What was that about?
It's pretty much to classify the drugs into schedules.
Very good.
It's made to combat drug abuse.
Okay. To classify, not just drugs in general, classify what?
Controlled substances.
Controlled substances. Okay? What are the schedules like? Schedule can also be called class. Very good. Okay, so schedule. Talk about the schedule. Schedule 1.
It has no approved therapeutic effect.
Very good. That's called C1. Okay? C1. Example of Schedule 1. Marijuana, which still federally, okay, is counted as a C1, which is illegal drugs. I know there are so many states that approve marijuana, both medicinally and recreationally, and we're going to talk about that in a bit. Schedule 2, Edwin.
That the most potential being abusive.
The most potential for abuse is 1, followed by 2. So the lower the number, the higher the potential for abuse. C1 is more addictive than C2. C2 is more addictive than C3. C3 is more addictive than C4. C4 is more addictive than C5. It's in reverse, huh? Okay. So C2, example.
Oxycontin.
Oxycontin, how many refills for C2?
0.
0 refills. How long is the prescription good for?
14 days.
14 days. No refills allowed. What is another important information that you need to know about prescription that contains C2? Special notes.
It has to be signed in black or blue ink.
Has to be signed in black ink by the prescriber. All of these we're talking about, C2, C3, C4, C5, must have, the prescriber must have what?
The DA.
A DEA number, which we will talk about again today, okay? How do we know whether a DEA number is correct or is valid? This always comes up as a question on the PTCE and the ExCPT, okay? So that's one of our topics today. I just wanted to review so that the information gets added. Okay, C2 is for what? Usually, the class C. Pain, okay, very good. It's usually for pain, management of pain or pain management. Continue, Clyde. C3.
Has a small potential for abuse. The class is usually sleep, anxiety, or depression.
Correct. Okay. Less potential for abuse compared to C2 and C1. But C3, being controlled, can still be addictive. Okay? So, correct. SAD, it falls under SAD. We call it SAD, sleep, anxiety, and depression. Can you give me an example of C3?
Vitamin.
Vicodin, correct. Okay? What did I put on the board? I said this is easy to remember if we do it this way. 330, 300. What was that?
Codeine was 30, and I don't recall it.
Yeah. What do we call that? So if in the hospital they tell you, give me a Tylenol number 3. That's why I said 330, 300. Tylenol number 3. Tylenol number 3, schedule 3, with 30 milligrams of codeine and 300 milligrams of acetaminophen. I've been mentioning paracetamol. We don't use that word here in the US, huh? Okay, I'm just letting you know so you're smart consumers and buyers because paracetamol and acetaminophen are over-the-counter drugs. Okay, continue, Vanessa, C4.
So they're accepted medical use, low potential for abuse.
Compared to. You always have to say compared to because they're scheduled for a reason, okay? Compared to
Past 3.
the last three, okay?
And they have up to 5 refills, and it's okay to faster call.
Okay. 5 refills and what did you say last?
Oh, it's okay to faster calling.
Sorry.
You can fax or call in.
Oh, fax or call it in. Sorry. So, what is C4 used for in general? Because Clyde said C3 is for SAD, sleep, anxiety, and depression. Isn't C4 usually SAD as well, for SAD? Okay. So, C2 and C3s are usually for pain. That's how we categorize it so that we can remember it. Okay? C2s, okay, C1 street drugs, C2s and C3s are usually for pain. Okay? C4s and C5s are usually for SAD, sleep, anxiety, and depression. Okay? So think about C2 and C3. C2 is for pain, but C3 is for pain with less addictive properties compared to C2. Can you follow? Okay, take note of that. Because I know it can be confusing on our table because the refills, what's grouped? C3, C4, and C5 are grouped on the refills. The refills for C3, C4, C5 is what? How many?
5.
5 refills, not counting the initial fill. Can you follow? That's why I get confused. But you got to remember, C2 and C3s are usually used for pain. But of course, ADHD medication fall under which one? Most ADHD medications. 2. Okay, that's why I asked you during the interview, are you on any prescription? Okay? So you might turn positive on drug test, and I don't want you to be automatically terminated because you didn't have your prescription on file with the one who takes care of medical records for you guys. Okay? Continue. Where are we at? C5, Kaylin.
Low potential for abuse.
You have to say compared, yeah? Continue.
Use for sleep, anxiety, and depression.
Very good. Used for sleep, anxiety, and depression as well. C4 and C5 used for sleep, anxiety, and depression. How many refills again? 5 refills. Okay? So, with the scheduling of drugs or substances that are easily abused, what organization was created during this time, Ashley?
DEA.
The DEA. And DEA stands for? DEA.
Enforcement Administration.
Okay, the A is administration, not agency. Most common mistake. Okay? Take note. Even if you go to their website, you're going to see DEA. A is administration. People usually say agency because it is an agency. Okay? But know that that's that. Okay. Also know that there's a Tylenol number 4. What do you think the class of that is? What do you think the schedule of Tylenol number 4 is? C4. Okay. Good job. What are exempt narcotics? Examples of exempt narcotics. Back to you.
These are selected cough or antidiarrheal medications.
Very good. Okay. Any questions at this point? The next items I'm gonna review you on, you covered in your inventory as well. Okay. What's that DEA form? I'm talking about this because this is the part where DEA was created. Okay. So many requirements by the DEA now with the scheduling. What do you call? This comes up on the PTCE. This 3 forms always. Okay. One of these or 2 of these will come out. Okay. What form do you use to order C2s? Ashley.
DEA Form 222.
Easy to remember, right? DEA Form 222. What do you use to, what form do you use, what DEA form do you use for the destruction, okay, of controlled substances? Edwin.
DA 41.
41. Remember how I told you for the Chinese, the number 4 is the number of death? That's how I remember it. For destruction. Okay. You kill it. Okay? You kill the prescription. You kill the drugs, okay? How to dispose of, okay? DA Form 41. And then theft, which pharmacists hate doing, but we have to do it if a theft happens, okay? Because you have to report that, okay? What do you call that form, Kaylin?
DA Form 106.
106. Those three usually come up on the PTCE. Okay. Yesterday we talked about 1970. I think we skipped. Oh no, we did Poison Prevention Act. Okay, so 1970, the Poison Prevention Packaging Act, which I think I did get to highlight this one. Okay, which I wanted to highlight. That's why we're going over all of them. What does this law cover? Back to you, Vanessa.
All over-the-counter and legend drinks should have childproof of the infection of.
Right. We don't want, this is how I remember it, we don't want children to get poisoned by prescriptions, especially they're colorful, right? They look like Smarties. We use Smarties, we use Skittles, M&Ms, right? We don't want them to think that they're candies. So, 1970 Poison Prevention Packaging Act requires that all over-the-counter and legend drugs, with a few exemptions, must have child-proof cap. When you say child-proof, the standard was set to 80% of children younger than 5 should not be able to open the lid, and 90% of adults should be able to open it. Okay? But in reality, what happens? In reality, what do parents do? Can you open this? Right? Okay. But let me show you. This is non-child proof. Why is it non-child proof? Look at this. Okay? And then, this is child proof. Why is it child proof? You gotta push and turn before you could open it. Baby oil. Child proof, non-child proof. Think about the lid, the cap. Non-child proof. Isn't it annoying to open it? Like, you have to push it, then turn it first. I mean, push it first and then turn before you could get the baby oil. If you need baby oil. Right? Non-child proof. Okay? Non-child proof, again. 80% of children younger than 5 should not be able to open it. Pharmacies don't usually have separate. Okay, there are pharmacies wherein you flip it over and then it's a screw cap. Okay. So what happens, before we do that, on liquid, what do we do on liquid? We push this, like baby oil I was talking about, right? We push and then twist. Screw cap, non-screw cap. Child-proof cap, non-child-proof cap. What did I just use?
Child-proof.
This is considered child-proof. Okay. In other pharmacies, let me tell you, I have one. I don't want to go over it. So, you do child-proof one side, and then you flip it over, it's just screw. If it's screw, it's non-child-proof. Okay? So, you don't have to. But most of our vials, prescription vials, are like this. Okay? So what happens to patients, say for example, older patients, they have arthritis, they can't do child-proof caps. They tell you, they request you, you know what, I have arthritis. Okay? I cannot do child-proof. Okay? What do you do?
Switch the lid
Switch the lid to
to
Non-child.
non-child proof. Switch the lid to non-child proof. Okay? And then what do? You just switch the lid.
No, you need to have the patient sign a request.
Very good. Okay? They have to request it and you have to input that information in the system. Okay? So you're not liable if something happens. Okay? has to be recorded in the system that the patient requested for non-child-proof cat. That clear? Okay. 1972 Drug Listing Act. What happened here? We talked about this, the other day. What happened? What about the Drug Listing Act? The creation of what code?
NDC.
NDC number. Okay. What's NDC number? What does NDC stand for? National Drug Code. How many digits is that? 11 digits. You have to know this. This always comes up on the PTCE, okay? How it's broken down, which is which, okay? NDC number is the identifier of the drug, okay? Identifier like a name badge, like a number, employee number of sorts, right? Okay, so what's the first 5 digits?
The manufacturer.
The manufacturer's code. What's the next 4? The drug or the product. What's the last 2? Packaging size. 1 or 2 questions may come up pertaining to this. Listen to me, okay? Because they come back and tell me. Okay, next one. 1983 Orphan Drug Act. We've covered that as well. What is an orphan drug?
Less than 100,000 people need it.
Okay, so these are drugs that are provided or can be used by a small group of people affected by a rare disease. And what is small group in terms of numbers? 200,000 people are affected by such disease or disorder. Okay, orphan drug. Okay, what does it do, Ashley?
Yeah, like,
What does the law pertain to?
like they encourage manufacturers to make orphan drugs by tax incentives.
Yeah, it encourages manufacturers to discover, produce, test, bring out drugs that are affecting a small group of people, about 200,000, by giving them tax incentives so that we don't neglect this group of people just because it's a small group. Right? Okay. Continue. 1984 Drug Price Competition and Parent Term Restoration Act. Kaylin, back to you. What happened here?
It encourages the creation of generic drugs and innovative drugs.
Correct. So competition. There is competition now. So generics are available to consumers or patients or to the market. But pharmaceutical companies cannot just automatically create a generic product, right? To compete with the OG. Okay? Because there's what we call what, Geneva? Patents. Patents are good for how long, Clyde? Current, as of 2022, patents are good for? This is a good review, huh? Very, very good review. So that before I add more information, like you're tested on the previous one. That's how I studied before. Like, that's why I tried to study every day when I was younger, so that the repetition and then every new topic just gets added. Come final exams, it's not too much of an effort, right? Because you study in small chunks. Clyde, how long is a patent good for?
5 years.
Can't be 5 years because that's too short a time for manufacturers to recoup the cost of their investment, right? It takes hundreds of millions of dollars to bring out one product, okay? So, Kaylin, 20 years, that's the answer. PTCE, when asked how long is a patent good for, the answer is 20 years. In 1984, there's another act. Back to you, Edwin.
The Hatchman-Waxman Act.
Do it again. It's cute.
The Hatch-Waxman Act.
See, you're also in a hurry. Hatch-Waxman Act. What does it say?
Provided for up to 5 years extension of patent protection.
Okay, because in the past, I explained this to you, right? Patents were only good for 17 years. So pharmaceutical companies can request for an extension for an additional 5 years, because by 17 years, if they haven't recouped the cost of their investment, they wanted to extend that. So generics should not be produced. Then it's become a total of 22, right? Well, that was gone. So when you're asked on the PTCE, how long are patents good for? The answer right away is 20 years. Okay. Then 1987, Clyde.
The Prescription Drug Market Act,
Okay, what does it say?
to control the use of drugs in animals.
And then caution. What does it say on the caution?
Federal law restricts this drug to use by or on the order of a licensed veterinarian.
Okay. This says that if a drug is for animals, has to be a veterinarian prescribing it. Okay. Same is true with dentists. Should not be prescribing contraceptives. You follow? They're only required, they're only allowed to prescribe within their practice, the limits of their practice. Can you follow? Okay. 1987, let's go. 1990, I talked about this yesterday. OBRA. Talked about this a lot. Okay. OBRA 1990. The OBRA 1990 has something to do with budget, right? What does it stand for? Omnibus? Budget Reconciliation Act. Okay. Originally, okay, started for lowering taxes, has something to do with budget. What has that got to do with pharmacy? Okay. It didn't have anything to do with pharmacy until 1993. But the law still remains OBRA 1990. Okay. What does this law mean when it comes to pharmacy? Why are we affected by this? Why is our practice affected by this? Edwin, continue.
The act requires that as a condition of participating in the medical program states that established centers of practice of the
Stop. Your own words.
um
Pharmacists are required to
what's called the required DUR
do DURs,
counseling patients.
offer counseling. If you have to say it in one phrase, what about OBRA and what it pertains to in our practice, the first thing that you should say is pharmacists should offer to counsel, because pharmacists are deemed the experts or knowledgeable when it comes to drugs to help better patient care. You follow? And we talked about the different DURs. Okay? What are the different DURs? Can you name some? Which I'm picking up from my homework. Okay. We have drug-to-drug interaction, drug to food, drug to allergies, drug to age. Okay? I asked you yesterday to find examples of drug to food allergies. One is grapefruit juice. Okay? So drug to food. Warning on grapefruit juice. Once you see a prescription for what? Okay? You have to ask the patient, right? That's what I'm telling you. Interviewing the patient and putting in information such as allergy in the system is not counseling. It's not illegal for techs to do that. You follow? Okay. So grapefruit juice, very popular drug to food interaction. Start with you.
Statin drugs.
Statin drugs. Okay. Simvastatin, atorvastatin. That's number one. Okay. Statin drugs and grapefruit juice. And you know why? That's always a question on the PTCE as well. Which amongst this will interfere with grapefruit juice? Then you have to find anything that's statin, generic, or brand. You follow? It's always statin that they use. But of course, there are other group of drugs. Did you find any more for grapefruit juice other than statin?
Calcium channel blockers.
Calcium channel blockers. What else? Continue, Edwin. Keep going.
Anticoagulants.
Anticoagulants. Keep going. The list goes on. But the most common one is statin, huh? Okay, the most common one is statin. That's what always gets asked on the PTCE. Okay.
Those are the only ones that I wrote.
The three ones?
Yeah.
Okay, the three major ones.
Yeah.
Number one, statin. Calcium channel blockers. and anticoagulants. You raising your hand?
Oh yeah, I got one.
Okay, continue. For grapefruit and grapefruit juice, huh?
I also got pickled cured fermented foods with NAOIs.
Oh, hang on. Grapefruit juice first, because I'm going to jump to that one, okay? Anybody, if we're forgetting any, I want to make sure that we've covered everything.
High blood pressure drugs.
Antihypertensives, okay?
Specifically nifedipine.
Nifedipine specifically. Good job. Grapefruit, huh? And grapefruit juice. Okay. Now, there's another group that always comes up. Food group. The drug to food interaction question that always comes up on the PTCE as well. Tyramine rich food. Tyramin. Tyramine rich food. Okay? What does that mean? Remember I told you I had this book called Pharmacology Made Ridiculously Simple, and then it has like sketches. To remember tyramine, there's a picture of a tire, okay, with cheese, sauerkraut, okay, pickles, okay, beer. So now I know that those are tyramine-rich food. You see? Can you picture? Tyramine-rich food. And now, Ashley, your turn. Tyramine-rich foods such as pickles, sauerkraut, beer, cheese should not be taken with
NAOIs.
MAO inhibitors. Monoamine oxidase inhibitors. I don't want you to just know the acronym. What if it's the whole word or the entire monoamine oxidase inhibitor that's in there? Remember this two big drug to food interaction. Okay? Just in case you forgot in pharmacology. That's why I'm banking on the seniors a lot. Okay? Or if you haven't gotten to that part of the pharmacology. That clear? Okay. Are there any drug to food that you will mention? But these two are big. That's why I want you to look them up. Because you're going to remember. Okay, once you look it up. If I just say it, it's just one of those words I said. Yeah? Any more?
Calcium-rich foods and antibiotics.
Calcium-rich food and antibiotic. Okay? Because it will interact, it will precipitate. Okay? Very good. Anything else?
Anticoagulants.
Anticoagulants and?
Vitamin K.
And vitamin K rich food, which is your greens, leafy greens. The greener, the more vitamin K. Examples of those are broccoli, spinach, kale, Brussels sprouts. Vitamin K rich food, no with anticoagulant. That's a big one. Comes up too. Those are three big ones for the PTCE. Okay? Remember those three. Okay. Anticoagulant, anti-clot, right? Mm-hmm. Anti-clot. And then what does vitamin K do? It's a clotting factor. So what do you think will happen? The opposite reaction, right? Okay. Let me highlight this as well. Common mistake. Vitamin K is not the same as potassium. Okay? Potassium, the symbol K right there, first row, group 1A, okay, came from the word kalium, K-A-L-I-U-M. Give me an example of a food that's rich in potassium. Banana. Very good. Okay. We call in hospitals IV bags that has high potassium content banana bags. Okay. What is it used for? Hangover. Okay. I always say this when you're hungover, but don't come to my class hungover. Okay. You're not even 21 yet.
I know.
You're giggling. Okay. So when you're hungover, life hack, fun fact, eat bananas. Eat bananas. Who watches Grey's Anatomy? Oh, see? That was still my time, right? And still going right now. Okay. There was one episode in there wherein I can't remember which doctor though, because I don't watch it anymore. I don't watch series after I gave birth. I don't have time, or I'm not gonna be able to feed my family if I watch series. I get hooked. Okay, so there's one episode in there that one of the doctors went out drinking, partying, okay, and he called one of the nurses and then shut the curtains and says, "Give me a banana bag," and she injected him with an IV with potassium. Okay, so that's why it's kind of a life hack. But don't come to my class hungover, please. Okay, I'll send you home real fast. Okay, so next one, drug to food, drug to drug interaction. Drug to drug, do you want to mention any more? Food, drug to food? Those are three big ones. They come up on the PTCE. Drug to drug. No more drug to food?
I got drug.
Okay, continue, Ashley. Drug to drug interaction.
Viagra and nitrates.
Viagra and nitrates, yes. Your afils, sildenafil, tadalafil. No on nitrates. Common question, big one. Okay, Kaylin. I'm not gonna give a pop quiz. You did your homework.
Antihistamines and sedatives.
Antihistamines and sedatives, you mentioned that yesterday, okay? Because of the dizziness and drowsy effect, that will be increased, okay? Back to you, Geneva.
I have ACE inhibitors and spironolactone.
ACE inhibitors and spironolactone.
I saw it on the exam.
Common suffix for ACE inhibitor.
Enalapril.
Pril. When the generic ends in pril, they're ACE inhibitors. You know that.
Oh, I got a specific one. Digoxin and amiodarone.
Digoxin and amiodarone. Digoxin and amiodarone. Did you get that? Did you have that?
Yeah.
Okay, very good. Clyde, drug-to-drug interaction.
I didn't write it.
You didn't write it?
No,
Did you look them up?
I didn't.
No? Okay. So you gotta look up the things I say, because sometimes I walk in here and say, get a sheet of paper, and I give a pop quiz. I ask you about this. Okay, because that's where I pick up from. Okay? Were you here when I did that pop quiz?
The last time.
The last time? Yeah. Okay. Verbal order. Okay. Vanessa, continue. Drug-to-drug interaction. Kaylin, any more? These are your warnings. NSAIDs and beta blockers. Did you find that? NSAIDs and beta blockers. NSAIDs and beta blockers. I talked about Tylenol, which is acetaminophen, and ibuprofen yesterday. You can take them, but not together. What's the distance? How far apart?
Hour.
Minimum of an hour. Okay. I do 2 hours. We're almost there. Any more drug-to-drug interaction? You mentioned the major ones. Continue, Ashley.
I found a warfarin and an antimicrobials.
Warfarin and antimicrobials, okay? Warfarin and antimicrobials, good. Drug to drug.
I have ACE inhibitors and potassium supplements.
ACE inhibitors and potassium supplements, correct. Okay. Since you mentioned potassium supplements, diuretics, specific diuretics and potassium supplement. Okay. So, there's what we call potassium sparing diuretics, right? That means it doesn't deplete the potassium levels. This is one of the cases I wrote for that workbook I was talking about yesterday. Okay? So, generally, diuretics, what do diuretics do?
Water pills.
These are your water pills. They make you pee. Okay, what's a natural diuretic? Coffee, right? Think about coffee making you pee all the time. Yeah, diuretics do that. So, most diuretics, because you excrete, right? Increase excretion. You excrete potassium with it. Okay? But there's a group of diuretics that's called potassium sparing diuretics, meaning it spares the potassium from being excreted. Okay? Usually diuretics are taken with potassium supplements, right? But the potassium sparing diuretics, you should not take potassium supplementation with it. Okay? And so the case can be patient is taking care of her husband, hospitalized, gave the husband potassium tablets because she read on Google that when you're on diuretics, you should be on potassium supplementation. But the husband almost went to shock. Okay? But the husband is on a potassium sparing diuretic, which you don't need the potassium supplementation on. You follow? Okay, now I want you to look up potassium sparing diuretics if you forgot. What are those drugs or diuretics that are potassium sparing? It spares the potassium from getting excreted. That's how I remember it. Do you have it? Triamterene, correct. What else?
And you look the drug name?
Yeah.
Okay.
So you're gonna look this up because your options, multiple choice options, will be the drugs itself. It's not gonna say potassium sparing diuretics. Can you follow? Which amongst these drugs you think the husband is on?
I got furosemide.
Furosemide. Is furosemide potassium sparing?
Oh no, that's loop.
Can one that validate? Furosemide is a loop diuretic.
Yeah.
So yes potassium, no potassium.
No potassium.
If it's a loop diuretic, yes potassium, yes potassium.
You have to.
Only
If it's a sparing.
the potassium sparing, because it spares the potassium from being excreted. Can you follow? Okay. I'm trying to make it so simple. I'm trying to make it so that you'll remember it. Okay. Examples of potassium sparing, triamterene. Midamore. What else?
Spironolactone.
Spironolactone. Any more? Those are major, huh? You should know those because you can figure out if that's in there. You can single it out, or if you know the potassium sparing, you know that that group doesn't require potassium supplementation. Is that clear?
Yes.
Are you learning not only law but also pharmacology review? Okay, add this on to your reviews. Okay, moving on. Drug to drug, drug to disease. Drug to disease. Did you find, I didn't assign it, but did you find some? Drug to disease interaction.
I know cough medicine should not be prescribed to somebody who has heart conditions.
Okay, decongestants actually.
Oh, decongestants.
Decongestants to those with hypertension, because decongestants increase blood pressure. That's one. So if you're caring for your parents with hypertension and they're congested and they want to grab decongestant, make sure you find something that doesn't have decongestants. Very, very good. Good. I almost forgot that one. That's an over-the-counter, and that's important. Okay. Because decongestants increase blood pressure. So you don't want to give that to those with hypertension. Any more you want to mention? Is this drug to disease?
Thereby.
No! Don't do that.
I was gonna say ibuprofen has a risk of people with liver problems.
Opposite. You said it wrong. Tylenol, acetaminophen, liver damage. Ibuprofen, gastric bleeding, so bleeding problems. ulcers. You see?
Yeah.
Or NSAIDs in general. NSAIDs may cause gastric ulceration because of bleeding problems. But bleeding in general, okay? Gastric bleeding. But the bleeding comes out usually in different parts. Like nosebleeds. Okay, very good. The one I mentioned yesterday, you mentioned it again. You're listening. I'm surprised. No. I'm kidding. Any questions? No questions? It's about 50 minutes of review, almost an hour of review. That's good. So I'll give you a 10-minute break. That doesn't count towards your break. Just to breathe before I start with HIPAA. Are we good?
Yes.
Okay. So that's a really, really good review until we get back to HIPAA. Okay? Breathe, collaborate for your presentation. Presentation is tomorrow, right? Be right back.
Yeah, I combine those two.